Chapter 28: Tetracyclines, Glycocyclines, Aminoglycosides, and Fluoroquinolones. Tetracyclines work to inhibit protein synthesis. They're considered a broad spectrum and bacteriostatic. They're effective against gram positive and gram negative bacteria, such as H. pylori or MRSA, sometimes used to treat things like acne, rickettsia, skin, respiratory, and urinary tract infections, as well as STIs, anthrax, plague, and cholera. Side effects of tetracyclines would include things like anaphylaxis, superinfection, a discoloration of the teeth, tongue, and nails. Do not give to children younger than 8 years old. Photosensitivity, headache, glossitis, GI distress, C. diff, hepatotoxicity, and neurotoxicity. Another danger of tetracyclines are drug food interactions, such as things like milk products, foods high in calcium, antacids, irons, oral contraceptives, penicillins, and aminoglycosides. When giving tetracyclines, we want to carefully assess both vital signs as well as urine output, and keep an eye on the lab results, especially in anything related to renal and liver function. Before giving tetracycline, we want to make sure we obtain a sample for the lab and send that for culture and analysis. We also want to advise patients to use sunblock and protective clothing during sun exposure and encourage the patient to take the entire course of antibiotics. Glycocycline. This blocks protein synthesis in bacterial cells and is considered both bacteriostatic and bactericidal. It's effective against pathogens such as Staphylococcus, Clostridium, and Streptococcus. It also has complicated skin and intra-abdominal infections, such as community-acquired pneumonia or MRSA. Glycocycline has adverse effects such as anaphylaxis, superinfection, photosensitivity, headache, dizziness, weakness, insomnia, GI distress, Clostridium difficile, and elevated hepatic enzymes. Aminoglycosides inhibit bacterial protein synthesis and are considered bactericidal. They're used and effective against gram-negative pathogens like E. coli or Pseudomonas, and also used to treat conditions like tuberculosis, tularemia, and plague. It can also treat serious skin, respiratory, urinary, bone, joint, and intra-abdominal infections. Aminoglycosides have side effects ranging from weakness, headache, fever, rash, pruritus, GI distress, superinfection, and deficiencies in B vitamins such as B6 and B12. This is in addition to ototoxicity, nephrotoxicity, and neurotoxicity. We want to carefully assess lab results of all renal and liver function tests and obtain a thorough medical history related to any renal and hearing disorders the patient may have previously had. We also want to take action. Send a sample of the infected area to the lab for culture and sensitivity. Carefully assess for any hearing loss and renal function, and check that the therapeutic drug monitoring has been ordered for both peak and trough drug levels. Fluoroquinolones interfere with DNA synthesis within the bacteria and are effective against both gram-negative and gram-positive bacteria, such as Pseudomonas, Salmonella, and Shigella species. Used for conditions like anthrax, sinusitis, typhoid fever, sexually transmitted infections, skin, bone, joint, intra-abdominal, urinary, and respiratory tract infections. Side effects or adverse reactions include things like anaphylaxis, superinfection, headache, dizziness, insomnia, hearing loss, photosensitivity, eye damage, visual disturbances, GI distress, and exacerbations of myasthenia gravis. When giving fluoroquinolones, we want to carefully record vital signs along with careful and accurate intake and outputs. Just like with our others, we want to obtain a specimen and send for culture and sensitivity. Checking our lab values for renal function, checking for signs and symptoms of superinfection, and encouraging the patient to report any side effects to catch them early. They should also be advised to wear sunglasses, sunblock, and protective clothing when in the sun. For our first practice question, a patient is receiving gentamicin therapy, 100 milligrams intravenously at 08, 16, and 2400. At 0730, the nurse is informed that peak and trough levels need to be drawn. When is the best time to obtain the peak level? 08, 09, 1600, or 2330? That answer here is going to be 0900 hours because it is allowed time to elapse since the last dose was given. So keep in mind, ideally, you want to get your peak level 30 minutes after you've given that dose. Practice question 2. Which statement by a patient who has received teaching on tetracycline therapy indicates that more teaching is needed? A. I will store the medication away from light and extreme heat. B. I will use an additional contraceptive technique because this drug may cause the oral contraceptive I take to be less effective. C. I will take this medication with an antacid. Or D. If my stomach becomes upset when taking this medication, I'll take it with non dairy foods. And that answer is going to be C. I will take this medication with an antacid. Because again, those antacids are chock full of calcium. And we do not want to take these medications with calcium as it can block absorption. And for our final question, what antibacterial drug has the potential to cause adverse reactions of tendinitis, tendon rupture, and peripheral neuropathy? That be A, cephalosporins, B, tetracyclines, C, fluoroquinolones, or D, aminoglycosides? And that answer is going to be C, fluoroquinolones. But anyway, that's all we got for this chapter. I'll see you in the next slides.